Hey, what's up, YouTubers? You wouldn't believe what happened to me. So I went to play basketball. I only got back recently. Last 2 weeks ago, I went and played basketball on Wednesday just to keep my fitness back on track. So I played then. That went well. And then the second week I went back, I actually ruptured my Achilles. It's never happened to me before. What happened was I was playing basketball, I turned, and all of a sudden I just felt sore on the back of my left heel. I thought someone stepped on me, or it felt like someone stepped on me. But when that happened, I just sat on the ground, and then I was kind of shocked, and I tried to get up on that left foot, and I just couldn't weight bear. Usually when I twist or sprain my ankle, it'll be sore and that I can actually walk, but this time I just couldn't put any weight on that left foot. So what happened was I got the boys to kind of carry me to the sideline, and then I sat there, just checked my ankle and had a look, and it wasn't really swollen and it wasn't as painful either. So I wasn't sure what was happening to it, but it felt really weird. It felt like when I got it, someone kind of stepped on it or kicked it. But as you all know, when you have an Achilles ruptured injury, they say you can't really feel it as much and you won't see any swelling as much as well, because it's fully torn. When it's not fully torn, when it's partially torn, you can still feel the pain. But when it's full torn, then you can't feel as much pain. So I got the other guys to help me walk to my car. Couldn't play anymore anyway, so he walked me to my car. Luckily the car is automatic and I was able to use my right foot to drive home. So when I got home, my wife helped me get out of the car and walked me inside the house and to the bed. So when I got home, I just wanted to have a shower. So when I had a shower, it was so hard, I had to go into the shower on the floor and shower from there. And when I finished showering, I had a look at my ankle, I bandaged it, and I thought about going to emergency first, but I just felt so tired, so I was just gonna see the GP in the morning. So I bandaged it, went to bed, and then the next day I went and saw the GP. So the next day my ankle was slightly swollen, slightly bruised as well, and I had to get crutches, otherwise I wouldn't be able to move around. And it's the first time I was in crutches and it was so difficult to use. I think I should have gotten like a learner's on my back, because I was like moving slowly and didn't know how to use it properly. So when I got to see the GP, she had a look at it. She said, okay, you're gonna go get a ultrasound and an x-ray, which was just next door. So she booked me in for that, but it was around the afternoon that I was booked in. So I had to go back home, wait for that appointment, and then go and see the radiologist. So when I got to the radiologist in the afternoon, they did the x-ray first. The x-ray was done, and then after that it was the ultrasound. So when I was doing the ultrasound, I told the lady that I was playing basketball. I've injured it, and I thought, yeah, I might have done my Achilles. So when she had a look at it, she seen the rupture, and she said it's fully ruptured. So she also got to see the radiologist. So the radiologist came in, had a look at it, so that he can tell me what was wrong with it. And then they also did the report straight away, so that the doctor can get to see what the results is. So when we got the result, they also printed out the x-ray for me so I can bring it to the doctors. Unfortunately, the doctors was already she's already left at about 3 o'clock in the afternoon, so we were gonna book in with another doctor, but I was just feeling tired. I wanted to go home, and we thought we'll go see the doctor tomorrow, the next day. So we went back the next day at about around 9 o'clock, and the doctor said, yep, it's an Achilles rupture, and you need to quickly see the orthopedic and also the physio, which was at the injury center. So she rang them. They don't open till 10, so I rang them at 10, and luckily they had an opening at 11, so I made that appointment at 11, and then I went and saw them at 11 o'clock. So when I saw the lady from ultrasound, she was already telling me that you're gonna need surgery, and it's gonna be a long recovery. It's about 3 months. So I told my wife, and she was like, yeah, if you're gonna need surgery, you're gonna need surgery. So when I went to see the physio, he had a look at it. He did all those tests and assessment, squeezing the calf to see if you see any movement from the ankle, and definitely there was no movement there. He tried to feel for more pains around the ankle to see if any other tendons were ruptured or torn, because you do have a lot more tendon around your ankle as well. So pretty much he started squeezing on the back of my ankle where the Achilles is, and kind of just checking from where the attachment is. And he said that from, I think, where the attachment is to where it's torn, it's about 3 to 4 centimeters. So he did all the flexing assessment, and after that he told me it's gonna take 3 months to recover, and I have an option to either go surgery or non-surgery. I told him I'm only a weekend warrior where I only play basketball occasionally, and I told him I probably won't go back to playing it again, but I do want to play it again, so we'll have to see how I recover. So he said that I have an option, and the option is either go surgery or non-surgical. And with surgery you recover quicker, and you also have more power on your left ankle. Although they said that there's not much difference now with the re-rupture rate. Before, in the past, they said you gotta go surgical, is less re-rupture, but now they're saying there's not much difference between re-rupturing from having surgical and non-surgical. But of course, if you're a sports athlete, a professional, and that's what your job is, to do sports, you'd go for the surgical option so that you got more power on that left Achilles. With saying this, the physio also said that if you're not gonna be active or not doing all those type of sports, you can do non-surgical. So we're going with the surgery. There are some complications like infection, skin numbness, nerve damage possibly, and those things can be also a risk when you're having surgical for your Achilles. So I told him I'm gonna speak to my wife and see what my choice is, and he told me you'll be booked in on Thursday to see the orthopedic surgeon, which is next week, and you can decide from there and see what he advises you. So I have till next week to decide whether I'm gonna opt for surgery or have non-surgical recovery for my Achilles. So while I'm waiting for my appointment next week, the physio said he's gonna put me on a plaster, and the plaster is gonna go on top of my feet so that I can keep my feet into a plantar flex position. So my toes will be pointing like that, and my leg will be kind of like that, so that the ankle is closer to where the torn is. So the Achilles is gonna be around here, and then where the torn is will be a lot closer. So if you have it like this, it'll be stretched out, and if you have a long Achilles, you won't have much power into that Achilles. It'll be loose, so you're gonna need surgery on that one. So it needs to be flexed so that you have a closer gap when you're having recovery and when you're healing from the injury. So when they put on the plaster, it felt pretty heavy. I had to get my left leg used to it. So when I'm walking around with the crutches, I have to lift up the left leg to make sure that the plaster doesn't slip down, because if it does slip down, it kind of hits my toes. So when I'm walking around, I make sure it's lifted up on the back, towards the back, so that way it doesn't kind of slip off. So, but with the plaster, it's great because it's keeping my plantar flexion position all the time, and I can't move it back that way. So it's gonna help heal the back of my Achilles, so that when it's short, I can always do the rehab and make it stretched, and then that'll keep it strong. So I think he said that I'll be having the plaster on for 3 weeks, depending on what my option is for either surgery or non-surgical. And then after the 3 weeks, I'll be using the boot, and with the boot they're gonna have like wedges, I'm pretty sure, in the back, and then with the wedges they kind of like take it out one at a time every week to make sure that your plantar position starts to kind of go back to the normal position. So after that, I got my appointment, and then I drove back home and I told my wife what my option is. And so I told her that I'll see them on Thursday and I can figure out if I'm gonna do surgical or non-surgical. So comment below and let me know if I should go either surgical or non-surgical and why. Oh yeah, I almost forgot to say, you have to be on Clexine as well, and it's an injection just to avoid any DVT. But yeah, when I first had it, it really hurts. Like, even though the needle is tiny and it's subcut, it felt really sore. So pretty sad that this had happened to me, but anything can happen. So hopefully this doesn't happen to you, but I'm pretty sure if you're watching this video, you might have injured your Achilles. So I'm on my 4th day of this injury, and just going to the shower, it's really difficult, and even just standing to use the toilet, that's pretty hard as well. So you kind of make sure that you've got your crutches and using it properly. So I kind of watched a video on how to use my crutches and how to adjust it. But when you're going around with the crutches, it's really hard to just use your hands to grab stuff or carry stuff. So what I did was I got some knee pads as well. So with the knee pads, I am using one of these knee pads. So I'm using this. What I'm doing is I've got this really long sock. So when I put it on, I have the pad in there where my knees are, and then I'll be just kneeling around the place with it on, so that I can use my hands to grab a plate or even just a cup. I can do that, but I can't do it all the time, because you get pretty sore knee as well, and you're a lot slower going around. But that's what I've been doing so that I can use my hands, and then I'll be using also my crutches to walk around with, and then with that I'll just be hopping with my good leg. So just remember guys, anything can happen at an instant, and it can change your lifestyle, and it also changes your family's lifestyle. So now I have to recover for 3 months. I also have a son who is 1.5 years age, and it's really hard to look after him because you can't even carry him when he wants to be carried, or you can't even run after him when he wants to play. So those are the things that you should think about when you're living life. Always be wary of what's happening, but it can happen anytime. So just some additional information. When I was speaking to the physio, because during COVID not a lot of people were exercising and doing activities, so he said that there was a lot of Achilles rupture after the COVID pandemic, because nobody was exercising. So pretty sure that kind of happened to me, because I haven't played basketball for probably 1.5 years, and I was just trying to get back into it, and all of a sudden this happened. So pretty much I'm sure that my Achilles were weak, and that just doing that sudden movement of running off and being explosive when jumping kind of put a toll into my Achilles and rupturing the left Achilles. Usually they said that people rupture the left side or left leg. So follow my journey on this recovery, and I'll post some update on what's happening to my recovery, and I'll let you know what my orthopedic says or advise me to do. And yeah, just let me know or comment below on what you think I should do, surgery or non-surgical. And thank you for watching, and I'll see you on the next one. Peace.